All right, this is the review for movements, directions, planes, and joints test. The first one is anatomical position, feet shoulder width apart, palms forward. The next are the planes. The midline or the median plane dissects the body in equal parts, left and right. The horizontal or the transverse plane comes out of the umbilicus and separates the body from top and bottom. The coronal or frontal plane divides the body part front and back, while the sagittal plane divides the body part in unequal parts, left and right. Direction, superior. Superior refers to anything above another body part, so my head is superior to my hips are superior to my toes. Inferior is anything that's below, so my feet are inferior to my hips are inferior to my head. Proximal and distal works up the extremity. Proximal is closer to the midline, where distal is further away from the midline. So my shoulders are proximal to my elbows, my fingers are distal to my elbows. Medial and lateral work side to side on an individual body part, so my pinkies are medial to my thumbs and my thumbs are lateral to my pinkies. Anterior refers to the front of the body, posterior refers to the back of the body. So my face is anterior compared to the back of my head, which is posterior compared to the front of my head. Superficial and deep. Superficial is closer to the surface, so my skin is superficial to the bone, whereas the bone is deep compared to my skin. Supine is a position in which a patient is lying flat on their back, and prone is a position in which a patient is lying on their stomach. Movements, internal rotation is axis of the movement of the axis towards the midline. This is an example of internal rotation. This is an example of external rotation. Abduction is lateral movement of a body part going away from the midline, whereas adduction is lateral movement of a body part towards the midline. Circumduction is circular motion. Flexion is the shortening of the angle. Extension is the lengthening of an angle. Hyperextension is where it goes to the extension and goes beyond that range of motion. Inversion is specific to the feet. Inversion is the sole of the foot goes in, where eversion, the sole of the foot goes out. Plantar flexion, the toe is pointed down and the plantar surface of the foot is flexing, versus dorsal flexion, where the top of the foot is flexing, the toe comes up. The next four are specific to the wrists. We have ulnar deviation, radial deviation, we have pronation, and supination. And the last is the joints. The shoulder and the hip is an example of a ball and socket joint. The elbow and fingers are examples of the hinge joint. The axis and atlas is an example of a pivot joint. The thumb is an example of a saddle joint. The spine and the carpals are an example of a gliding joint. And the wrist is an example of a condyloid joint.